you. Great stories. Just a wonderful reminder about our life and what a mosaic it is that actually defines who we are. And what I'd like to do for the moment I have with you is to reflect maybe backwards, as opposed to beginning as a youngster, starting from where I am today with Trinity Health, kind of reflect on what I've observed joining this organization 5 years ago, and then sort of map back to what I do today, being driven by what I encountered as a youth. First of all, Trinity Health is a very large healthcare organization, multi-state, 8 states, coast to coast, 45 hospitals, many long-term care services, home care, etc. 45,000 associates in the organization. And so you can imagine the diversity that we represent by way of neighborhoods, communities we serve, the people that then work with us to serve patients that walk through our doors. It's really just truly a remarkable story. And so let me tell you 2 encounters that I had when I first joined the organization as CEO. I moved to southeast Michigan, just outside of Detroit, where our home office is located. And I'll never forget one of our senior executives, African American, came to me and he said, and we were talking about diversity. It was actually just kind of a serendipitous conversation. It really wasn't an intentional engagement in and around diversity and inclusion. But we got to talking about it, and he said, what's remarkable about my life here is that the only person that I have, by way of inclusion, to have a relationship with on this executive team is the security guard who comes in after the doors close. Think about that. Back up about a week before that, I was with our diversity work group, and as new CEO, they brought to me kind of a chronological layout of what they had worked on going back to 1986. And I just patiently sat and listened to the stories, and of course this was at that moment 2005. So I said, now that you look at it and you told me the story, what do you think we've achieved in 20 years?